Premiums have gone up for people taking health insurance on Affordable Care Act plans.
It's something we said was definitely going to happen this year. KOCO's Jason Berger talked to the Oklahoma Insurance Department about what is driving those costs up.
Across the nation, Affordable Care Act insurance premiums have gone up 60 to 70% in some cases, but not the case here in Oklahoma, according to Deputy Commissioner Mike Rhodes at the Oklahoma Insurance Department.
We are not seeing the Armageddon event that was predicted. We are seeing a 20 to 21% increase average.
However, a 20% increase is still making an impact.
So they have moved from a silver to perhaps a bronze plan in order to fit their family budget.
And people that are choosing to be uninsured altogether are on the rise.
What we will see here is an increase in the uninsured rate here in Oklahoma from what has been about a 10 or 11% back up to the 13 to 14 to even 15% of the population without insurance, uninsured. That equals to about 40,000 Oklahomans that have elected not to pick a plan.
Rhodes says there are three main elements that contribute to that 20% rate increase, or higher ACA health insurance costs. The first is federal premium subsidies, or tax credits, expiring at the end of 2025. But patient acuity and morbidity are the two other factors. Oklahoma is 47th in the country with health status.
That drives costs up with respect to how sick they are and what kind of acuity they have with respect to their medical conditions.
And at the end of the day, if people go uninsured, that cost shifts to taxpayers through uncompensated care, public health funding, and Medicaid.
This shifts the costs away from the members into the public setting, into the public domain, and we all pay for that cost shift.
In OKC, Jason Berger, KOCO 5 News.